Sleep paralysis. That's the temporary inability to move or speak. So, right before you go to sleep, that little paralysis that happens, we call it a hypnagogic paralysis. When you wake up, that little paralysis that takes place is called the hypnopompic paralysis. It's very important. The issue with this conversation is that the person is conscious. They are awake mentally, but their skeletal muscles, it remains paralyzed because their body is still in a state of REM sleep. Now, REM stands for rapid eye movement sleep. It's very important. I'm going to talk about that in a little while. Now, this can feel terrifying. It is not life threatening. It is just a miscommunication between the brain and the body, and it is temporary. I need you to understand that right now. What happens in the brain and the body normally when we enter into the rapid eye movement sleep or the REM sleep, our brain tends to be very active. So, this is the stage when we dream. Please remember that. At the same time, our brainstem sends inhibitory signals to the spinal cord to produce something called REM atonia. So I need you to know that the REM atonia shuts off your voluntarily muscle movements. Please get that in your brain right now. So this prevents us from physically acting out our dreams. Very important. So in sleep paralysis, the transition between REM sleep and the wakefulness gets out of sync. It definitely gets out of sync. So the reticular activating system, the part of the brain that wakes me and you up, becomes active. But the motor neurons in the spinal cord are still suppressed. Please get that in your mind as soon as possible. So you are conscious, you are aware of your surroundings, but physiologically, we are paralyzed. Very important. Sleep paralysis. So that's why you can't move. That's why you can't talk. Even for you to open your eyes fully, it is impossible. That is exactly what is taking place in us. So, in such an episode, what happens to me and you is we are fully awake. We are just completely immobile. We cannot just move around for a few seconds. It could even last for a few minutes. Now, what are the symptoms we will face when we have this episode of sleep paralysis? We are unable to move or speak, despite the fact that we are fully aware. We could have chest tightness or a sense of pressure. Please remember our diaphragm, which is the muscle that opens and expands our lungs, that diaphragm muscle is partially restricted by muscle atonia. Please remember that you do feel episodes of shortness of breath. Super important. You also have this intense fear. You also have this panic, intense anxiety that takes place. You could even have vivid hallucinations. Please remember. Now, the hallucinations happen because the REM dream imagery leaks into wakefulness, creating what we call hypnagogic hallucinations. When it happens, we do see shadows. We feel some sense of presence in the room. We also feel like someone or something is sitting on our chest. Now, since ages of time, there has been historically making, we have something called the incubus phenomenon. Very important. Now, I need us to understand there is not one single cause, but several triggers have been linked to what causes sleep paralysis. What are the triggers? That we have sleep deprivation, we have irregular sleep cycles, psychological stress could happen and cause you unnecessarily sleep paralysis. Night shift, those who do night shift, I do night shift, you do night shift, it could cause sleep paralysis. Jet lag could cause circadian rhythm. So now to those of us who have the PTSD, anxiety, panic disorder, changes in our sleep pattern, we have to know that these could all trigger sleep paralysis. Genetic predispositions may also play a role as well in contributing to this sleep paralysis. In fact, some studies have been linked to the variations in genes that regulate REM sleep, that regulate rapid eye movement sleep. Alcohol, antidepressant withdrawals can also trigger episodes of sleep paralysis. Please remember that. And in some patients, we have something called narcolepsy. That is a neurological disorder that causes sudden REM intrusions during wakefulness. I need you to understand this right now. So how can a doctor diagnose me and you? The doctor is going to do something called polysomnography or overnight sleep study. These are very helpful. These are going to monitor your brain waves. It's going to also monitor your oxygen levels, monitor your muscle activity. This will help the doctor rule out any sleep disorders we also have as well. Very important. So if daytime sleepiness or cataplexy is also present, that is a muscle sleep latency test can evaluate for that narcolepsy, cataplexy. Please remember that. Aside it all, the doctor will have to dive deeper. He'll have to dig deeper and see what are the potential causes of this sleep paralysis. Seizure disorders could be a part of the contributing factors for the sleep paralysis. This happens, causes us loss of consciousness. We are not even aware of our surroundings. Night terrors could also be a part of it. Night terrors occurs even in your non-REM sleeps. It could be part of it. Panic attacks that occurs whilst you are awake, not during even REM transitions. This could potentially lead to that sleep paralysis eventually. So recognizing the timing, whether it is sleep onset or awakening, is what sets this sleep paralysis apart. Please pay attention. So most cases, usually they don't require medication. The focus is on your sleep hygiene, your lifestyle modification. Patients are encouraged. We have to tell these patients, we have to tell our family members, we have to tell our friends to please maintain a consistent sleep waking up schedule. Avoid caffeine. Avoid all this alcohol. Heavy meals before you go to sleep. Please remember, caffeine, alcohol, unnecessary heavy meals before you go to sleep, please avoid it. Practice stress reducing techniques such as meditation, deep breathing. These are going to calm me and you down. Avoid sleeping supine on the back, which is linked to more episodes of this sleep paralysis. Now, medically, the doctor will give us a medication called the fluoxetine. He could also give us a medication called the venlafaxine. Very important. He could also give us a medication called the clomipramide. Please pay attention. These are going to be given to us if these episodes of sleep paralysis takes place. So I'm here to advise you that this condition is not dangerous. Do you have any sleep disturbances, anxieties? Please let it be known so we can address it. We can see whether it could be linked to any potential sleep paralysis. I promise you, in cases connected to the narcolepsy, medications like modafinil can help regulate those sleep cycles. Pay attention. Sleep paralysis. This is a transient REM-related phenomenon where consciousness returns before our muscle control does. It's very important. A lot of people think it is spiritual issues. A lot of people think it's demonic related. It could be, but it definitely is not the reason why it is causing it. It is your neurophysiological misfire between your brainstem and your skeletal muscles. It can be frightening, it can be terrifying, it can be scary, but I need me and you to understand what our body is going through so that we can face the fear. We can eradicate that fear at that. Is very important. With good sleep habits, stress control, and awareness, most people experience fewer or less episodes of that sleep paralysis. So remember, your body is asleep, your brain is just waking up early, and for a few moments you are stuck in between both worlds. You are trying to wake up, you cannot wake up. Your brain is trying to tell you to wake up, but the muscle coordination is not there yet. Sleep paralysis, I promise you, this is a conversation that must never be forgotten. It's a very crucial conversation. Now, I need you to send it to your cousin, to your best friends, to your sisters, to your brothers who just told you about this sleep paralysis. Let's help educate each other. It's very important. I will always be here to advise you. My name is Nurse Solomon, and I'll see you soon.